Hi, I'm Yuki, pelvic alignment core yoga trainer, and she's Nidhi. She is a pelvic floor physical therapist. And today we are going to talk about anatomy of pelvic floor and some exercises. So Nidhi, where is the pelvic floor?
So I'm going to show you on a model. It's easier this way, right? So we're looking at pelvis. This is the bone on the left, and this is the bone on the right. And we kind of cut the top off, and we look inside. This would be bladder, where your pee is collected. This is the uterus, where the baby is. This in the back would be rectum, where poop is collected. If we remove all these organs and we look inside, you see this big red of structure here. It's the pelvic. So pelvic floor muscle simply sits inside, deep inside the pelvis. You can't really see it from outside. If I flip this over, you can see this is urethra, where you pee from, vagina, and then anal opening, where you poop from. These are the small muscles of pelvic floor, but the meat of it, the big muscle, the major muscle, is inside the inside.
So not one muscle, it's so many different kind of muscles together.
Yes, it's 7 muscles, 7 muscles that connect together.
Okay.
In here, I don't know if it's visible. They're different directions, but they work together. They work like a basket. They work like a sling. They all contract together and then they relax together. So it's a big basket of a muscle inside pelvis.
I see. So what is the Kegel?
So Kegel is the contraction of this muscle.
Contraction.
Right? Now, here's where most people are mistaken. People think that squeezing is Kegel because
that's what I thought.
Yeah. So this is the urethra. This is where the pee comes out from, and you can squeeze the opening. You can squeeze these small muscles and close the opening, and that's one part of Kegel. Definitely, it squeezes these openings and closes them. But most of what this muscle does is it contracts and it lifts up these. So if all of these organs are here and the pelvic floor is underneath it, the contraction of pelvic floor will basically lift these organs up. So it's not just the squeeze, it's a lot of it is the lift that happens. So Kegel is the contraction of pelvic floor where the organs are lifted and the openings are closed. Both.
Not just squeeze.
Not just, which is what most people tend to do, is just squeeze.
Right.
It's the lift and the squeeze.
I see. Okay, so can you explain how to coordinate breathing and pelvic floor?
Okay, so that's a good question. We're going to explain why breathing is important. Even, we talk about pelvic floor, why do we talk about breathing at the same time? So breathing happens from a big muscle underneath your rib cage. It's called diaphragm. It's like a dome. It looks like this. And then in the pelvis is basket-like muscle, pelvic. So this diaphragm and this pelvic floor kind of work together. They become sort of partners. So when you breathe in, the diaphragm goes down, the pelvic floor goes down. When you breathe out, the diaphragm goes up, and the pelvic floor comes up. So they both work together up and down. It's not that they can't work against each other, they can, but in a normal situation when you're not doing anything, not making them work against, they're typically going to work together in the same direction, both going down or both. So the coordination of breathing with pelvic floor, the easiest coordination would be when you breathe in, you relax your pelvic floor, and when you breathe out, it doesn't mean that this is the only thing that will happen in body. Opposite things can happen, but this is what usually happens. This is the easiest. So we can show, I can show it on you, how to coordinate breathing and Kegel. But before we do that, let's talk about Kegel. Like, when we're you're telling your clients, or I'm telling patients, how to do a Kegel, I don't like to say squeeze, I like to say lift. So a few cues we can use. We can say, okay, think that you have a tampon in your vagina and you want to pull it in. Like it's falling out and you want to pull it back in.
Okay.
Sometimes we say, this is a funny one, say there's a straw in the vagina and you want to sit through the vagina.
Uh-huh.
So, and then you want to pull up. So
Okay.
whatever cue you can give your clients to sort of suck or
Ah.
pull. So we want to think about something in down here is coming up inside the body. That's the cue I want to use. I typically say if the patient has used a tampon, I would say, you know, how there's a tampon, you want to pull your tampon in.
Okay.
I don't like to use the cue hold your pee because holding your pee can happen with just it doesn't always need that lift. So if the person is used to squeezing, they might just squeeze and they won't get the real benefit of doing the pelvic. Whenever you do a lift, the squeeze comes with it. But if you do a squeeze, lift may not with it. Does that make sense? So we can show. You're gonna come lie down with your head there. Yeah. So if I'm gonna lower this a little bit. Okay. So if you're lying down, what I want to do is want you to put one hand on your chest and one on your belly, and you're gonna put it right just a little bit above your belly button. That's where your diaphragm is. Okay. I want you to breathe in to this hand and not this hand. So I want you to breathe in so this hand comes up and this hand doesn't.
Okay.
And then I want you to breathe out like you're blowing a candle. So we do this so we work the diaphragm properly first. And once we have the diaphragm working properly, the pelvic floor will come in much easier. Okay, so breathe into this hand one more time. Breathe out from your mouth like you're blowing a candle. And after you do this a few times, you got the hang of it. Then this time you breathe into your hand, correct? And as you breathe out from your mouth, think of pulling a tampon in. So this is the easiest way to coordinate breathing with pelvic floor is breathing in and relaxing. So when you breathe in, you want to think that your pelvic floor is letting go.
I should be relaxed.
Yes. Forget about pelvic floor, right? But if you're having trouble relaxing, you can think that your pelvis is getting larger or your pelvis is getting bigger. You can think that your sit bones are coming apart. You don't actually move and you just think that your sit bones are coming apart. You can think that your pelvis is getting larger and bigger. When you breathe in, that everything is getting filled up with air, everything is relaxed. And then as you out, you think about this basket here that's coming. Longer you exhale, so I typically say I want your exhale to be longer than 5 or 7 seconds. So longer you exhale, longer duration the pelvic floor will contract and hopefully have a good contract.
So this is how many times should I do a day? Maybe 10 times? 10 reps.
Depends on why you're doing it. For my clients that I see, mostly new moms, if your pelvic floor is weak, 10 times is probably too much, too many times. You can do it because you're a yoga trainer, you're very healthy and you have been doing these. But somebody who is leaking or somebody who just had a baby, typically 5, 6 repetitions are long enough and the muscle starts to get tired. I say if you feel the need to squeeze, then stop. Because if you feel the need to squeeze, then your lifting muscles are getting tired and now you're starting to compensate by the smaller muscles and you're starting to squeeze. Not that squeeze is bad, but lift is what is the major part, right? So 5, 6 repetitions. I'll give my patients 2-3 times a day. But again, this can change a lot depending on how strong the person is when we see them and what their background is. Have a baby? Do they have pain?
Thank you so much.
You're welcome.
Right. So maybe you can try these breathing exercise. Beginning is 6 times a day. 5 to 6 times a day.
Yeah, 5-6 times in a session. 2-3 times a day.
2-3 times a day. Next video, we're gonna talk about the leaking and incontinence. So if you were interested, please join this. Please
Conversation.
Please watch this video.